is about the NAC or N-acetylcysteine. This is an amino acid, or it's actually a precursor to an amino acid. So let's start talking about that one. So I'm going to share my screen and we'll talk about it. So this is the situations, 4.4 million people infected and 302,000 deaths. Okay, so let's start. Hey guys, how are you? So thank you very much for joining. We are going to start with the N-acetylcysteine, or also called NAC. So let's talk about this. First of all, look at this formula here, this formula, and look at this formula. The basic difference between them is this acyl group here, this acyl group here. So basically, N-acetylcysteine, this guy, is a derivative of levocystine, which is an amino acid, and the difference is that we have an acetyl group attached to the N over here. Good. Hey guys, thank you very much for everyone for joining. Today's lecture is very important. N-acetylcysteine is a very important supplement for inflammation control, for proper immune response, for proper oxidation reduction functions, for proper control of reactive oxygen species, for proper control of the thrombotic events in the COVID-19 and other viral diseases or bacterial diseases. So this is a very important topic that we are discussing today. And we're talking about the N-acetylcysteine, which is a derivative of L-cysteine, so L-cysteine, this guy is an amino acid. Now the question is, why don't we take the L-cysteine or this guy instead of its derivative, that is this one? The reason for that is that when we use L-cysteine, when we give L-cysteine, it goes into cells where the function is not very interesting. On the other hand, N-acetylcysteine or NAC, when we administer that, it goes into those cells where it is really useful. Plus, it is more easily permeable into the cells as well. This is why, as a supplement, we administer N-acetylcysteine instead of L-cysteine, which is here. Now, L, which is, of course, a form of N-acetylcysteine, has a few functions that are interesting. So number one, two L-cysteines bind together through a disulphide bond. So if you see here, see this H over here? So this is a reduced form. So we release the H, we have two of these molecules come together, release their H, that means they get oxidized, create a disulfide bond, and they come together. When they are together, these guys together are called cysteine as well, or cysteine. So that is the first important thing, actually the second important thing to know, that there are two pronounced similarly words. One is L-cysteine or cysteine, and the other one is also pronounced cysteine, but the spellings are different. One is E-I-N-E and the other one is I-N-E. The difference between them is cysteine, I'm just going to say it, cysteine, the one that has E-I-N-E, that is one amino acid, and cysteine is two amino acids joined together with the disulfide bonds. That is the difference between them. Now, this amino acid is not an essential amino acid. Our body can manufacture it, but still providing supplements can help us. The dimer here, this dimer, when it is formed with those remember these sulfur bonds here? It is formed with those sulfur bonds, and there are a couple of benefits of this. Number one, these sulfur bonds here or disulfide bond here, it is very easy to become reduced. So it takes part. So it is, this whole molecule here is called a nucleophilic molecule. Plus it is easy to break as well at the sulfur bonds. Plus, because these sulfur bonds are between the two amino acids, it is easy to form tertiary shapes of the proteins. So when we have a protein thread, so let's say here is a protein thread, and we want to make that into a three-dimensional globular structure. Let's say this is a hemoglobin's globin. This structure formation needs lots of sulfur disulfide bonds that offer the protein to be folded correctly. So disulfide bonds are important. So once again, going back to this one, cysteine, which are two cysteines bound together with the disulfide bond, they have two basic functions. Number one, they create mechanical linkages within the protein to create 3D shapes of the protein. If this was not happening, we will all be flat like a paper. So this 3D structure is given by, to our proteins, is given by this dimer. Secondly, because disulfide bonds are easy to oxidize, to reduce, that is why these take part in oxidation reduction actions as well inside the cell. So with this, going back to the discussion here, we have this N-acetylcysteine that will make or help make cysteine. Now cysteine here, this guy, is also a precursor for glutathione. Remember yesterday we talked about glutathione? So just a very quick discussion from yesterday. We talked about here. Remember we talked about reactive oxygen species, that we have oxygen here. Oxygen, when we reduce it with an electron, it becomes superoxide. When we further reduce it with another electron, it becomes H2O2. When we further reduce it, then it becomes H2O or water. Water is the most reduced form, and the oxygen here is the most oxidized form. And then we know that in this process, there can be reactive oxygen species or these monsters that can be formed, which can cause DNA break, they can cause lipid break, they can cause protein break. And when we have viral infections or bacterial infections or external stressors, they also help produce reactive oxygen species, and it is important that we counter them. And we saw yesterday that we had NADPH and we had glutathione that helped with that, correct? So keep that in mind, right? So Gary says, Jerry says, I'm one step ahead of you, doctor. I ordered NSE and I have it in my drawer to take. Help me bring up much should I contract? Absolutely. So you should take NSE without even the COVID-19. NSE is in the world WHO's essential drug list's most safe drug, which is an essential drug as well. So back here, N-acetylcysteine eventually is also important to help make glutathione in the reduced form, which is called glutathione, so GSH. Now here is the chemical formula for the glutathione, and if you see here, in this part is cysteine, this part is glycine, and then this part is glutamic acid. So there are three amino acids that come together to make glutathione. This is why it is called a tripeptide, or three peptides or three amino acids. So it's a small protein. Please keep that in mind. That small protein, this being a small protein, is an important thing for us to know, because this tiny molecular weight of this glutathione will be used up later to react with the reactive oxygen species. So this is why it is called a scavenger molecule as well. So we saw that yesterday, that once we have the glutathione, we saw this thing that here are the monsters. These are the reactions. We want to reduce them to make them into water. To reduce them, we have to oxidize something, and here is the 2GSH, 2GSH, which will be oxidized into GSSG. So really, these are two glutathione molecules or that come together, they become oxidized and they become this. In that process, the reactive oxygen species become reduced and they become water. So all good. The good thing is many of our molecules that can become oxidized, sometimes they become wasted. They are oxidized and they are destroyed. Glutathione can become oxidized and then can become reduced again and become available again. So this is a guy who can be punched around by the reactive oxygen species, get destroyed, then become regenerated like a phoenix, and then get destroyed again. So this is the function of glutathione, which is very important to fight with the infections. And you can imagine this, that if a cell has an infection in it and there are reactive oxygen species in it, then the glutathione levels have to be high so that we can fight with the reactive oxygen species, which is a severe case in case of COVID-19. And for this glutathione to be present in the right amounts, we need NAC. So NAC would help replenish glutathione. This is a very, very important thing. And I would just very quickly show you a study. So this is what is N-acetylcysteine, glutathione. Here is a study which is very interesting. In this study, if you see here, they have shown two functions of NAC. One of the function of the NAC is that when glutathione is used up, for example, this is Tylenol toxicity or paracetamol toxicity. So this is paracetamol. When it becomes toxic, this is its metabolite in the liver, and if it is in too much quantities, it causes liver cell damage and immune response or inflammation in the liver, causing death. Now, this metabolite of paracetamol or Tylenol is further oxidized by GSH. But if GSH itself is depleted because there is too much of the toxic substance, then we would start getting the toxic effects of the metabolites. So what happens is NAC is necessary to produce cysteines. Remember, NAC and cysteine are derivatives of each other. And these cysteines are necessary to produce glutathione. That is what we were just talking about. And then glutathione, once replenished, can take care of the toxicity or toxic metabolites. This is why Tylenol or paracetamol toxicity, the antidote is the IV or oral glutathione, NAC. Similarly, we'll see here the other function of NAC in a second, but I wanted to make sure that we are aware of how this works. Okay. So now once we have the glutathione available, one function of that is taking care of the reactive oxygen species. Second function we just saw is the, for example, Tylenol toxicity and taking care of that. Then here is another important function. This is also very, very important. So look, here is the situation. These are this monster here, this monster are the reactive oxygen species. So let's say there is a patient who has gotten COVID-19 infection or influenza infection or some other reason to have reactive oxygen species stress. Once that stress is present, please realize this one. In our cell, there are two types of ways to counter the reactive oxygen species. One, we have enzymes that can actually convert reactive oxygen species into more reduced form or water, or they can kind of help us detoxify them. So these enzyme examples can be catalases, peroxidases, superoxide dismutases. These are the enzymes that can take reactive oxygen species and kind of kill them. But these enzymes are not enough. So what do? We also need something that can become a target of reactive oxygen species intentionally. This is like a decoy. It is, we need a small thing, remember glutathione is small, that can stand in front of this bully, the reactive oxygen species, and the bully would try to oxidize this thing, and then bully would think that I have done a damage to this, but that little hero will become alive again by becoming reduced again. So who is that? We need a small molecule that can go through oxidation reduction repeatedly. That is glutathione. And who helps us make more glutathione? NAC. People with the NAC deficiency have more infections and have more inflammations and have more cellular damage and have more lung damage because of the reactive oxygen species. And when I said lung damage, I want to make sure that we consider this. There is a study, I'll show you that study. There is a study that says, or that has looked at the, here. If you look at this study says repleting glutathione by NAC. So using NAC, the drug that we are, or the supplement we are discussing today, by using NAC, when we make GSH, it has the effect of reducing PMN into the lung, but increases them at the site of infection. So somehow NAC administration helps glutathione production, which in turn helps balance out the immune response and focuses that response to the pathogen instead of healthy tissues. So this is a very, very important concept here. So again, glutathione, I'll go back here, repleting GSH with NAC. So although we are singing praises of GSH over here, but this GSH level is maintained by NAC. So if we do not have NAC, then GSH level is not going to be maintained. If we do not have the correct GSH level, then the reduction of the reactive oxygen species will not occur. That means continuous damage will happen. Good so far? So what we have done so far is a couple of things. What we have seen is that N-acetylcysteine gives rise to cysteine dimer, which is part of the enzymes and proteins that need to be folded to make a globular protein. So that is one function. Second function is it is an important precursor to make glutathione. And then we looked at glutathione in some brief way as well to see, okay, if it is a precursor for glutathione, helps us make glutathione, what is the use of glutathione? And we know that glutathione plays a role in antioxidation, that is one. It also plays a role in a similar way by oxidation of the paracetamol or Tylenol metabolites. And then we also saw that it is necessary, we call it a scavenger molecule. It is necessary to be a scavenger molecule in our cells for reactive oxygen species. And remember, it has to be in sufficient quantities that the reactive oxygen species can connect with it. If we have 1 million reactive oxygen species in a cell and only 100,000 glutathiones, then that is not sufficient. If there are 1 million reactive oxygen species, we probably need 5 million glutathiones to sit around. Then another important function of glutathione. So we are still singing the praises of glutathione. I'm going to go back to NAC in a second. The important connection here is NAC helps have the right quantity of glutathione. Another important thing is that when the virus or any pathogen is taken up by our first responders, for example, macrophage in this case, inside the cell at that time, it is important that lysosomal activity start. What does that mean? The activity to break down the pathogen, that has to start. And for that activity, for breaking down a pathogen, what do? We normally break disulfide bonds in that pathogen, in the proteins of the pathogen. And guess who is needed for that? Glutathione. And who is needed for glutathione? NAC. If I do not have enough NAC, then I do not have enough glutathione. If I do not have enough glutathione, then I do not have enough glutathione to break the pathogens that are in our immune cells. So immune cell function is also helped by glutathione, which is helped by NAC. So hopefully this much is clear. We have seen a bunch of effects of NAC through glutathione. Plus we have seen that NAC helps make proteins. Now let's look at some direct effect of NAC as well. So here, NAC was used in the past as a mucolytic in respiratory infections or respiratory diseases. For example, cystic fibrosis. What happens is that here, if you look at it, and this is a study as well, that study is, yeah, here. So I've kind of redrawn this picture. So this is the study. In this study, what they're saying is that imagine this green and black. They are two strands of mucus. These are glycoproteins, right? So these are two glycoprotein strands. Why they become thick and elastic and sticky is because they develop disulfide bonds between them. Because they develop disulfide bond between them, those fibers, those glycoproteins, those mucus threads, they fuse with each other, they bind with each other, and they become plugs and they become sticky. Now, to break them, we give NAC. So we're not talking about glutathione anymore. Now we are singing the praises of NAC itself. The NAC, when given, would attack these disulfide bonds and would cause their reduction. So see here, this is one thread, this is the other thread. On one thread, the sulfur is now reduced. On the other thread, sulfur now has NAC attached to it. And then there is one more attack, and then both of those are going to become reduced. The point is the NAC can attack directly the disulfide bonds and break them. Now keep this in mind. This is not only necessary for mucolytic, this is also going to be necessary to break the bond between a platelet and von Willebrand factor, which is a thrombotic outcome of COVID-19. Remember, we have been talking about it for days now, that what happens is when the COVID-19 is in our, infects our endothelial cells through the ACE2, then the endothelial cells become damaged, plus they release the, von Willebrand factor from their Weber-Plaudet bodies, plus the subendothelial von Willebrand factor is released, plus the von Willebrand factor that was present inside the plasma, which is stabilizer for factor VIII, that becomes stressed out as well. And when that becomes stressed out, those von Willebrand factors, they show disulfide bonds that start connecting together and then start connecting with the platelet. That is how platelet aggregation starts. And this guy, NAC, breaks disulfide bonds. So imagine the importance of NAC to reduce the thrombotic activity of COVID-19 and thrombotic activity in general. So this is one example here. Mucus plug is broken down into single. So normally what happens is that we have the NAC, we have a protein that has disulfide bonds in it, and NAC comes in the first go and it breaks this disulfide bond. Then if you do it again, so see this got reduced. If you put NAC again on this guy, then even this bond would get reduced to SH. So there's two attacks that it does, but eventually it breaks the disulfide bond. When it breaks the disulfide bond, that breaks aggregates. Good? Now, with this all in mind, let us now cysteine. This is the last part and connected to COVID-19 as well and connected to any other infection as well. So first of all, we just talked about it. It's a GSH precursor. Through the GSH, it will do antioxidant activity and a very important thing against COVID-19 or other diseases which are infective or which cause reactive oxygen species stress. That is one, very important. Second, reduces platelet aggregation. So we just talked about it. Let's look at it once more. I've been drawing this diagram for some days now. I think now you would know this diagram by heart. So this is a blood vessel. This is a blood vessel. These are endothelial cells. And then under the endothelial cell are the von Willebrand factors. Inside the endothelial cell and the Weber-Plade body are also von Willebrand factors. And then inside the plasma are like sailing like ships are also von Willebrand factors, which are stabilizing factor 8. Now, when the COVID-19, when the SARS-CoV-2 comes into our body and it connects with the ACE2, that ACE2 connection eventually would cause local inflammation, correct? Which would then cause destruction of the local endothelial cells. So when they are destroyed, what happens is collagen is exposed. We almost make this diagram daily, so I'm not spending too much time on it. The von Willebrand factor is exposed. Then this ship-like von Willebrand factor that is running around in the plasma, it is called high molecular weight von Willebrand factor. The one that is under the endothelium is called low molecular weight von Willebrand factor. The one that is running around in the plasma is called high molecular weight von Willebrand factor. This high molecular weight von Willebrand factor is a very sensitive protein. It is very, very sensitive. It is very moody. Small shear, small stress to it causes it to start creating disulphide bonds. So as soon as the COVID-19 is present and there is stress in the blood vessel through which this ship was passing, then what happens is that these von Willebrand factors, all of them, they start showing disulfide. They start opening up their disulfide areas and they start bonding. Now, this also starts bonding with platelet. These disulfide bonds also allow platelets to start bonding there as well. And that is the start of the platelet aggregation or thrombosis. The NAC has a speciality of cutting the disulfide bonds. This is its direct action. We're not talking about through glutathione. It has a direct action on cutting the disulfide bond, which would release the platelets and which would also cause less platelet aggregation, which would cause less inflammation, less thrombosis, less hypercoagulability in the patient of COVID-19. So imagine, just like vitamin D is crucial. Now there are so many studies out that say that if anybody who is deficient in vitamin D has a higher chance of developing severe COVID-19 and even dying from it. Similarly, NAC is another supplement which is really important to reduce the hypercoagulability and to fight with the reactive oxygen species. Anybody who asks you, how does it fight the ROS? You say through the glutathione. And how does it fight the hypercoagulability? Your answer is going to be it reduces the thrombotic plaques by attacking the disulfide bonds in the von Willebrand factor, which will reduce the coagulation. So that then, going back here, so this is the platelet aggregation we just talked about. Paracetamol, Tylenol toxicity management, we already talked about it. Mucolytic, so cystic fibrosis and COPD patients used to use them because it breaks the mucus plugs. We just talked about that as well. Then a direct factor of reducing the function of coagulation factor 2, 7, 9, and 10. That is also its direct evidence-based observation. I do not know the exact mechanism for how does it do it. I would suspect it does the same way as by attacking the disulfide bonds, but I'm not sure. So it reduces the clotting by reducing the factor's activity as well. So look how many ways it is reducing the clotting. Number one, platelet aggregation reduction. Number two, blood clotting factor reduction. Number 3, disulfide bond in the von Willebrand factor. So all of those are very, very important for inflammation and reduction and control. So this is what is N-acetylcysteine's function. I hope it is clear. I hope you enjoyed that the N-acetylcysteine is such a beautiful product. It is in the WHO's list of the essential drugs. It is in that list, and it is the most safe drug. It is safe in pregnancy as well, as far as I have studied. But if somebody is pregnant, they should not take anything unless they talk with their doctor. So I don't want to put you or your baby at risk. So do not listen to me there. So this is what we have. What are the 3 functions or 4 functions of NAC? It is a precursor to make dimers, cysteine dimers, which make proteins that gives and those dimers are in the proteins to make tertiary proteins or globular proteins, like hemoglobin's globin. Secondly, it is a precursor to make glutathione, which helps in the oxidation reductions. Plus, glutathione is a scavenger thiol molecule as well, helps the macrophages kill the pathogens as well. Plus, glutathione is also participant in the prevention or as an antidote for toxicity. And glutathione has many other functions. And then, so that is 2. Third, NAC can directly be antithrombotic by reducing the platelet function or aggregation, by reducing the function of some blood clotting factors, by reducing the disulfide bond in von Willebrand factor so that they do not connect with platelets. So by reducing the platelet aggregation's initiation. And then this is the basic function. So I hope that this is clear. After this, you would consider that NAC should be something that should be needed as well. And what I tried to do was, I did not go to the supplements, and because everyone who is selling a supplement tries to just talk praises of it, I went into scientific papers to see that what are the mechanisms that are important. So yes, it is found in the natural food. Our body can make it as well. So I'm looking at a comment there. And then we can take supplements too. Again, when you take supplements, we take N-acetylcysteine instead of cysteine, because N-acetylcysteine is easily permeable and can be taken orally and goes to the right cells. So this is what we have. Tell me, what would you like to do tomorrow? And for today, I would beg leave. We'll talk again tomorrow. Please like, subscribe to my channel and share this. And also, how about today I show you that I also have a website, which I have never ever tried to show the team the website, because I did not want to appear commercial when I'm doing these for a noble cause. However, since YouTube has started taking down our lectures, I wanted to show you that at least be aware that Drbeen.com is the site where all of these videos are eventually going, and I'm putting them there. So for example, if I go to the video library, these videos, I am uploading them here. So if they are not available on YouTube, they will be available here. But again, the point is not this, that I'm trying to be salesy. I think after 2 months, for the first time, I brought it up, just so that if people are looking for these videos, we'll put them there. I hope YouTube stops doing what they're doing, but meanwhile, we have a backup. So thank you very much. Tell me, what topic would you like tomorrow? Is it pregnancy and COVID-19? I have a bunch of topics that students had asked for. For example, NSAIDs and COVID-19, pregnancy and COVID-19, alcohol and COVID-19, then mortality in various ethnic populations. We have done that. Vascular endothelial growth factor as a final common pathway for the COVID-19 elderly people and what happens. I think I've done fatigue syndrome, then cardiovascular diseases we've done. So there are a bunch of topics. I can either pick up one of these, or please share a topic here that you would like me to talk about. So for today, thank you and see you tomorrow. Please share this. Thank you very much. Bye-bye.